I'll now show you the local points for frozen shoulder. The local points will start here with the large intestine and the triple burner meridians. You'll locate these by finding the edge of the acromion process. And you just follow the spine of the scapula all the way to the edge of the shoulder. And this is pretty much at the start of the deltoid muscle. And you'll find that there's a posterior and an anterior side of the acromion process. And the large intestine point is on the posterior side, and the triple burner point is on the anterior side. So we're going to do both of them. And this is an 1.5 inch needle. I'm going to do the large intestine one first. And you're going to just find the depression where your finger sort of falls off of the acromion here. And then insert the needle perpendicularly. So you're just going to go straight here into the joint. And again, find that chi sensation. I'm about in here. I found the chi sensation. So this is about a 1/2 inch insertion. And then now we'll do the same thing on the triple burner meridian, and that's on the anterior border of the acromion. So these were both at about a 1/2 inch insertion, just straight into that joint space, and this really helps to benefit the joint space. The next point is on the small intestine meridian, and this one you can locate. It's on the posterior shoulder, and you'll find the axillary fold. So the top part of the axillary fold, and this is basically the armpit. So you're going to go about 1 inch above the axillary fold. And again, your client is laying on their side, their shoulder is depressed away from their body, and you're just going to go straight here with an 1.5 inch needle, and this is going to treat the joint capsule. So going with the needle, this is go about 1.25 inches, and then you'll come to a point where the tip of the needle touches that fibrous joint capsule. And you'll know that you can that needle's in the right spot because the edge of the joint capsule, it feels like you're almost coming up against like a piece of foam or like a piece of cardboard. It's almost a little bit spongy, and that's kind of where you want the tip of the needle to rest, is right up against that joint capsule, because again, we're working on getting fresh chi and blood to that joint capsule that's now frozen in place. The second needle that is on the small intestine channel that will also help to benefit the joint space is above this needle that you just placed here above the axillary fold. So follow that line straight up, and you're going to end up directly underneath the scapular spine. And anatomically speaking, this is a really safe place to needle because what's underneath this structure is basically the scapula. So a deep insertion is fine here, but just really make sure that your client is placed appropriately. So the shoulder is away from their ear, they're lying on their side, and you find this depression just directly underneath the spine of the scapula. And then as you place the needle, you're again looking for that joint capsule. And here we find the tip of the joint capsule. It's that nice spongy location. So both of these needles are located here into the posterior joint capsule. There's also an extraordinary point which is located on the anterior portion of the shoulder, and this is going to treat the anterior portion of the joint capsule. The reason why it's an extraordinary point is because it's not located on a traditional acupuncture meridian. This is basically an empirical point that has come about based off of hundreds of years of clinical observation. So you'll find that point, you'll find this large intestine point that you placed earlier at the end of the acromion, and then you'll find the anterior axillary fold, and then just find a point directly midway between two of them. And most people, this point is really tender, even people who don't have frozen shoulders. So when you palpate and you feel it, most people are like, oh yeah, you've got it in the right spot. This is like a really nice tender depression. And then again, you're just going perpendicular straight into meeting that joint capsule. And once your needle comes up against the joint capsule, you'll really feel that with the needle. And then all of these are placed appropriately to really bring more fresh chi and blood and pull out any stagnation in that joint capsule of the shoulder. So to recap, here we have points for frozen shoulder that are local and going directly into the joint capsule. Here we have triple burner and large intestine points, which exist directly off of the border of the acromion. And then we have small intestine points here that work on the posterior section of the joint capsule. And then here in the front, we have this extraordinary point that's located between the axillary fold and the acromion. And this is working on the anterior portion of the joint capsule. Because frozen shoulder has such a strong emotional component associated with it, I like to do a couple of additional distal points that really help to calm and relax the client. And you can do these after all of the other needles locally for frozen shoulder have been placed. And the first one that I'll show you is on the head. It's directly in between the eyebrows, at the midpoint of the eyebrows. And this really helps to focus and calm chi. It also really helps to activate the parasympathetic nervous system, the rest and digest nervous system. So your client will always feel really good when this needle goes in. And you can use this placement for pretty much any condition that has an emotional component to it as well. So to place this needle, you'll just pinch the skin here between the brows. And then this is going to be a transverse or oblique insertion, and you're going to angle the needle downwards towards the nose. So you'll pinch the skin and then insert the needle and then just angle the needle down towards the nose. And this is a shallow insertion. This is about 1/4 to maybe 1/2 of an inch insertion. And this really just helps to bring a lot of calm and relaxing. This is Shen calming, spirit calming point. The next point I'll show is on the heart channel, and this is really going to help to even further calm and relax the Shen, and it's really nourishing for the spirit. So to locate this point, you'll ask your client to make a loose fist with their hand, and this is where either the ring or the pinky finger will rest. So basically when the hand is into a fist, it will rest right in between the 4th and the 5th metacarpal, and that is exactly your target for this point. So you place the needle just right here in the palm, and again, really press down with that tube, and then insert the needle nice and slow. And this is a shallow insertion. This is about 1/4 to maybe 1/3 of an inch. And you'll find that point of chi, and you can almost just feel the client have like this nice state of relaxation. And this is a really wonderful addition and ways to help your client find like a nice balance of calm and relaxation, even when they're on an acupuncture table with needles.